Dear listeners, this is the TV and this is the program of health and lifestyle. My name is Dr. Rodgers Kajabwangu. I am an obstetrician gynecologist. I work with Mbarara Regional Referral Hospital. Today, we are going to discuss a very important topic in pregnancy that is called preeclampsia. You've probably heard the term. It is a medical term, but simply put, it is high blood pressure in pregnancy. It is a condition which has high blood pressure as the main factor, but it is actually much more than that. And we are going to take a few minutes discussing what it entails, how you can know that you possibly have it, what you can do when you get the symptoms that make you think that you probably have it, and also how it can be prevented. We'll also discuss some of the risk factors for this condition. But I want to begin by saying that it is fairly common. It occurs in about 5 out of 100 women, pregnant women in the whole world. This is a global statistic. And it is one of the major causes of death in pregnant women. In some countries it is number 1, but here it is number 2 after hemorrhage or bleeding in pregnancy. But the good thing is, in some ways, it can be treated if diagnosed early. And I am happy that we are having this discussion so that we can have an idea, we can all have an idea about it. So, what really causes preeclampsia, we don't know, but we think currently as scientists that the main reason it comes is it has to do with the placenta. The placenta is that part that connects the baby and the mother, through which the baby gets nutrition. So in some women, the placenta does not attach very well to the surface of the uterus, and that sets in place a series of reactions that lead to abnormalities in the blood vessels, and then you have high blood pressure coming in, and then you have also other complications like failure of the kidneys. This is a condition which can potentially be very dangerous. It can affect the brain. You've seen some women who convulse or fit when they have this condition as it progresses. It can affect even the lungs. You can get what we call pulmonary edema, which is water in the lungs. So it starts with blood pressure as the main thing, but then all organs end up being affected. And that is how we lose a number of women from this condition. So going to how you know that you have it, it is sometimes very difficult. Diseases like high blood pressure are hard to know that you have unless you have gone to a doctor or a health facility and they test and find that the blood pressure is high. Most times the symptoms come when it has already progressed to a very big deal. So when it has progressed, you can start feeling headache, you can start, some people have visual blurriness where you're not seeing very well. This condition also affects the baby. So some women, the first sign is loss of movements of the baby. When the mother is no longer feeling the baby kicking, they come to us, and when we check the blood pressure, we find that they already have preeclampsia. And so I want to use this opportunity to encourage all pregnant women to keep going to health facilities for checkup. The recommendation now is about 8 visits throughout the pregnancy. That makes it around 1 visit per month of the pregnancy. When you're doing those visits faithfully, we'll be able to check your blood pressure every time. And if it is high, we will know, and then we'll manage you accordingly. We'll manage the condition accordingly. Unlike some of our women who present to us very late, when already convulsions are setting in and all the other organs of the body have been affected, and we end up losing them. So please always go for the visits faithfully whenever you are conceiving. I promise to talk a little bit about the risk factors. If you have high blood pressure in this pregnancy, you're more likely to have it in the next one. If you have this condition in your family, you're also more likely to have it. Also, if you have other conditions like diabetes and even high blood pressure itself before conceiving, when you conceive, you're more likely to get preeclampsia. If you have other diseases which you call autoimmune diseases, where your immunity is very active, you're more likely to also get preeclampsia. So those are conditions, most of which we have no control over, but it just means that we need to do screening of these conditions and even control. If you know you're a patient of diabetes, before conceiving, first see the doctors and they stabilize the blood sugar, then you can conceive very well and we keep monitoring you. So that's a little bit about the risk factors. And when it comes to what to do when you think you might have this condition, I don't have much to say apart from encouraging you to go to the health facility. Go to the hospital. The medical workers are trained to control the blood pressure. First of all, to make the diagnosis, and then to give you medication to control the blood pressure. And many times when this condition comes, because I mentioned that it is related to the placenta, many times the ultimate treatment is delivery of the baby, regardless of the age of the pregnancy. And so you must be ready for that to happen, because sometimes we have to choose between the mother and the baby, because this is very, very dangerous to the mother. So again, if you feel any of the symptoms I talked about, like headache and visual blurriness, please go to the nearest health facility and the medical workers there will attend to you. So in terms of prevention, again, I know you're asking yourself, how can I prevent this condition from happening to me? Like I said, most of the risk factors, we do not have control over them, but at least we can do screening. We are about to start what we call a preconception clinic at the referral hospital, whereby women who are planning to conceive come and we check them before. We test you for conditions like high blood sugar or diabetes. We check your blood pressure before conceiving, and so many other conditions. And therefore, I want to encourage us to embrace this practice of getting preconception care. Some of us come, many of us now come when we are pregnant, but how about before? Before you get pregnant, please, it is good to see a doctor and discuss the plan. There are even some medications we can start you on if we think you're at a very high risk of getting preeclampsia in the pregnancy. So I think you've heard me mentioning it very many times, This is about getting screened. Whichever opportunity you get to see a health worker, please go and get your blood pressure tested, get your blood sugar tested, and discuss your conception plans with the health workers. So I've been talking about getting preconception care, but also when you get pregnant, as soon as you discover, that is the best time to go and and visit a health facility for what we call the first antenatal visit. Some of us think this should come way much into the pregnancy. Some of us want to come for the first visit at 5 months. That is not the right time. The right time is when you discover that you have conceived. You need to see the doctors right away. And then if we think you are at risk of preeclampsia, there will be some medications that we can start you on, but also we'll give you medical advice on what to do. The other risk factor I didn't talk about was obesity, or being obese or being overweight. That is also a risk factor. So for women planning to conceive, we encourage you to use the different measures of reducing body weight, exercise, and also changing your diet. So I believe we have had a brief but rich discussion about this condition. If you want to understand about it more, the next time you go to a hospital, you can have a discussion with your health worker. But I don't want to leave without encouraging you again to always go for checkups before pregnancy and even when you conceive. Thank you very much, and have a good time wherever you are.